So it says recording in the bottom right corner. I am recording the wound care video. I'm going to start by ensuring that the orders are appropriate for the patient and the wound. And I will pre-medicate for pain 30 minutes before. And then after 30 minutes, I will get started. I will gather my supplies, review the order to ensure I have all the supplies I need, sterile kit, saline. And at this point, I will take my supplies, knock on the door. Hi, my name is Claire. I'm going to be your nurse today. I'm just going to perform wound care on you and change your dressing and cleanse your wound. I'm going to ensure patient privacy. And now that patient privacy is ensured, we'll perform hand hygiene. And if you could tell me your name and date of birth, and if I could see your wrist. Patient is identified. Hand hygiene, privacy, I've explained the procedure, the orders. And at this point, I will put on clean gloves. We'll get the patient in a comfortable position, ensuring client comfort. Now that I have my clean gloves on, just gonna take the covers away. Now what I'm gonna do is uncover the wound and remove the old dressing. So I'm just gonna gently peel back the tape. Use an adhesive remover if I need to. Okay. Gonna discard the old abdominal pad. At this point, I'm gonna take out the old dressing or the old gauze, and at this point, I will look at the gauze, see if there's drainage, exudate, if there's any odor, no color, consistency, discard of that. And I will feel around the wound for temperature, notice any erythema, and any drainage, odor, things like that. Make sure the client is comfortable, ask if they're in pain. Then I will go ahead and measure the wound. My measuring stick. So I will measure the length and measure the width.
So how would you add in here?
I'll very gently measure the depth. Discard of that. Now that the wound is exposed and the dressing is removed, I'm going to go ahead and remove my gloves. Perform hand hygiene once again. And at this point, I'm going to prepare to put on the new sterile dressing. I'm going to unwrap the sterile package and take my gloves while maintaining sterile field.
You're not doing? So they can help you.
Will apply my gloves using a sterile technique. Taking care to not touch the gloves, making sure they're sterile. And adjust the cuff on this side. Okay, my gloves are put on, they're sterile.
Your mom?
Now everything in the package is sterile.
Inside is sterile.
Not very
Take the
familiar, to
tray.
be honest.
The drape
Not
on.
familiar, I think it's cancer.
Everything is sterile in this package. I have my biohazard bag. I'm going to discard of these because I'm going to use saline to clean. And I will have my assistant open the saline so that I do not contaminate my gloves. Okay. Thank you. Okay. And I'll have the assistant pour the saline into the tray. I'm going to take my
To your brother? What happened?
I'm going to take my 4x4s,
You just like,
Go over it and go nuts, read it.
get them wet. And now at this point,
Jesus.
okay, there we go. Just getting my supplies that I need. So now my gauze has been dipped into the saline. Now going from clean to dirty, I will cleanse the wound with the saline. Just ensuring I have all my steps. Go from clean to dirty. I'm going to make sure I do not touch the inside of the wound with the outside of the wound.
I can't touch the
Start with that.
And so if there was a magnet on here,
Dip this in the saline.
and go back,
Clean the outside.
and as I do this back, I just look at it.
Where's he at? In Canada?
Okay. One more time on the other side.
And I assess the wound, and it looks better than
And now, maintaining my sterile feel, I will take some gauze, measure to size, and making sure I do not touch the healthy tissue. I will pack the wound with some gauze.
Well, that's a quick fix, and it's still 10 minutes.
Yeah, it's in my
We'll put this in the saline, fluff it out.
I totally forgot that too. You also forgot to do hand hygiene.
Now this is
before you put
damp.
gloves on.
I did it too early.
Do hand hygiene gloves.
Avoiding touching the outside of the
So it's
wound.
like walk in,
New work.
oh.
Put that
and like do all
into
that
the
is
wound.
hand hygiene. Then after you've done all that, and like privacy, then you wipe it down, and after you wipe it down, you do hand hygiene before you put gloves on.
Yeah, hand hygiene gloves.
And now we've got clean wound, we've got dressing for the gauze, wet gauze, damp gauze
It says
in.
there's no point in leaving when I can't work and I'm on ODSP.
And now at this point,
Yeah, we call it government. I'm gonna do this like that.
I'm going to dispose of my sterile gloves.
So, oh, either way, I'll like I'll submit. I can see it. No, but okay, we have to make sure I have my gloves back there.
Perform
I'll put this here.
from hand hygiene.
Yeah. Okay.
And then where do you want these? Maybe in your way over
Now we'll put on a pair of clean gloves.
Move them out of your way, and you gotta lighten this up.
Yeah.
So, like, like this.
And you need to do hand hygiene basically as soon as you
As I walk into, yeah. I did it before I like
It doesn't, as long as it happens before you're really touching anything.
Kind of my clean gloves are on.
Before I entered the room, I did a
Checking in with the patient for comfort, any pain they might be experiencing.
doctor's orders and gather the supplies I need.
I take my abdominal pad, place it over the wound
And then the nurse
gently.
your name and date of birth. Perfect. Hello, Mr. Smith. I'm going to be doing a wound dressing usually. Raise the bed to provide privacy.
It was benign.
Gently apply some tape.
Okay.
But he likes to claim he has cancer
To the wound.
because he's a malignant narcissist. We can start.
Does he always do this like always thing?
The old fucker.
At this point, I will dispose of my supplies.
Oh, and it's my fault too. And he'll hold that to that part of
And correction, I would have put the soiled dressings and the used abdominal pad, everything that came from the wound into my biohazard bag and then disposed of it properly. Just making that correction.
Okay.
It stands for Robin Hood.
Okay. That makes sense. Jeez. I'm sorry. That is taxing.
Anything that is not contaminated can go in
Actually
regular
has
trash.
cancer.
Actually has cancer. And
And that will
my
be
husband's
disposed
mother
of.
was trying to convince my husband.
Remove my gloves, performing hand hygiene.
Because I think
Is there anything I can get for you? Alright, gonna make sure patient has colic
my husband's
within reach. Lower the bed to lowest position. Maintain patient privacy. Document my
There's a whole joke
findings.
about that kind of
Document
people. That kind of
measurement,
people, those kind of
drainage,
people.
everything relevant.
they are very
Check in with the patient. That is wound care.
I'm sorry.
Did I do it? Did I do it?
Just
Oh,
and all of this right now during school.
great.
I think so.
And